Hi, this is Jenny, and I've had some students ask questions about anion gap. So when I have more than one student ask me, I usually go ahead and just do a video to explain it to you because most likely some others may have some questions. Sometimes it's easy or hard to understand when you're reading in the book or watching on slides and you need just someone else to explain it again or maybe in different terms and you'll understand a little bit better. So when we think of anion gap, let's think of that as the difference between the positive and negative electrolytes that you have in your body. So you have, and also what I try to think of it as, take two cups, okay? You take two cups. One is cations, one is anions. Cations is positive, anions is negative, okay? Cations, your most common ones are what? Sodium is number one, right? And then you have potassium. Just remember, sodium is the most important. Then you have anions. Anions are your sodium bicarb, or your bicarbonate. Think bicarbonate, not sodium, sorry, take that out. Bicarbonate. And your chloride. You also have other acids and cations and anions that aren't accounted for, such as phosphorus, albumin, etc. Okay, so you have these two cups filled, one with positive, one with negative, and it's supposed to be an even, it's supposed to be even in your blood. So if sodium's pulling out, potassium's going in the cell. You have your blood vessel, right? Your blood vessel works to a fine tune as a blood buffer system, all right? So the buffer system works the fastest on making sure that those are exchanging how they should and keeping a normal homeostasis of your blood, all right, and all these electrolytes. So when we're thinking about anion gap is basically an equation. It's an equation that you take your cation of sodium and potassium and you add that together, okay, doing the math. And then you're going to take your bicarb and your chloride and you're going to add those two together. So you're going to get those answers, and then you're going to take your answer for the cations, your minus the anions, and that's going to give you your gap, your anion gap. Normal anion gap at most labs are about 3 to 11, give or take a couple points. So if it's normal, we're good. All right, why do we have a gap though? Isn't it supposed to be even? Because remember, we have this blood buffer system that's supposed to keep things even. Well, no, okay? We know in our body that yes, it's supposed to be even. Everything's supposed to be meshed together in zero. With an anion gap, remember, it's just an equation that we're getting an idea of what's going on. We want to get an idea if someone is producing too much acid in their body. All right, or isn't getting rid of enough acid, or doesn't have enough bicarb maybe to offset the acid. So that's when that equation comes out and gives you an abnormal over 3 to 11. Say it comes back at 15. That's telling me, what's going on? So why don't we have 0 in the anion gap? Number one, it's an equation just between those particular cations and anions. It's not accounting for other ones such as phosphorus, albumin. There's other positive and negative electrolytes, as we know, that are going back and forth, okay? But it's not being accounted in the equation. So don't get too hung up on that. Just realize that it's an equation that we're using to try to figure out if there's something going on in the body, if you're producing too much acid, or let's just, hence the other name is metabolic acidosis. So let's just say, for example, someone has an anion gap of 15, and the normal lab values are 3 to 11, and they're 15. So what is it telling me? Well, it's telling me, it's giving me a warning sign. First of all, are they making too much acid, like I said before? Or are they not getting rid of it, or are they having too much base? Most commonly is diabetic ketoacidosis. So you have keto acids. So that's why your blood sugar gets high. It's from a super high blood sugar, you're spilling the keto acids, Too many, you're producing too much, it's getting into the bloodstream. Too many of them, it's not able to, your body's not able to compensate. So you go into metabolic acidosis. So how do you treat that? Well, you can treat that by what? You go to the anions, all right? Oops, my video here. You have way too many cations of this lactic acid in your bloodstream, and so we need to offset that with more bicarb. So you can give sodium bicarb. There's other treatments for it too, but that is the treatment, so you want to buffer it. So just remember that the blood buffer system is the fastest way to treat an acidosis. It just maintains it. So that's why you're giving the IV fluids, because it's going right into the bloodstream to help that. All right. So you're going to see more of an increase. It's rare that you see a low anion gap. Sometimes if you have a low anion gap, it'll be maybe you have hypoalbuminuria, you have your low albumin, but usually you're always just going to see a high anion gap if you see one. So understand what your pH is in your blood, because remember that has to do with it too. So if you're more acidotic, the pH is going to go down, right? So try to understand that. And then what's the most common increase in anion gap? That's going to be acidosis. All right. So again, the most common is diabetic ketoacidosis. So your keto acids. You can also have lactic acidosis. So metformin is one drug that can cause lactic acidosis. It's really rare, but you have to always watch for that. The other thing is shock can cause lactic acidosis. And because think about what's going on in a trauma situation with muscles, it's releasing lactic acid. And also if someone overdoses on aspirin. But again, the most common is your diabetic ketoacidosis. You're going to see that more often than the other ones. So. Okay, just make sure I wrote down everything I wanted you to know. And just remember that when we think of anion gap 2, it's the equation, and then we have the blood buffer system, which is your bloodstream, which is keeping that anion gap where it's supposed to be, right? But then you have osmolality, and think of osmolality again as being like the buffer system, as keeping things how they're supposed to be, the right electrolytes in the cell versus out of the cell. And the one determinant that's the most important for determining osmolality is your sodium in your bloodstream. Once you start having sodium shifts, you're going to have other shifts, okay? So just try to remember that. And remember, there's so much sodium in water. So if you're retaining water, then what's sodium going to do? That's you're going to retain the sodium because it tries to compensate. All right, and I think that's about it. If you have any questions, let me know about that. I will also post a YouTube video that helps explain it too.